Coming to you live from the Fixel, the Norman Fixel Institute here at the University of Florida, which is a Parkinson Foundation Center of Excellence. It is really just awesome to be with everybody today and to be live, and we're just looking forward to having some time to talk a little bit about what's going on with Parkinson disease, and particularly there's been a lot of action going on about Parkinson and the vaccine for COVID-19. And for those of you who have been following along with us, we have had a series of these webinars, Facebook webinars, sponsored by the Parkinson Foundation. And so I want to thank the CEO, John Lear, for his leadership on this, and Leilani Pearl and Kathy Whitlock for really making this happen and making this work. And we do log these up on YouTube and on the websites, and we also keep a lot of information all the way from the beginning of the pandemic. It's available to you free, and that is at www.parkinson.org. And that's the website for Parkinson's Foundation. And if you put a backslash after www.parkinsons.org and either type the word COVID, C-O-V-I-D, or coronavirus, all one word, coronavirus, after the backslash, you'll be able to get directly to our information page. And Kathy's going to put up all the videos in order that I've done, so that'll be easy for those of you that have asked. And we certainly want to make ourselves available, and we've opened up comments and moderation, and we're going to answer your questions here in live time. We're happy to address anything, and there's been so much both excitement but also anxiety about getting the vaccine and getting access to the vaccine, and so we're so excited to be with you today. I also want to mention that we have the best-in-class group of nurses and health professionals at the Parkinson's Foundation, and they have a 1-800 number, and it's 1-800, the number 4 PD Info, 1-800-4PD-INFO. And for those of you that aren't old enough to know this, if you look at your telephone, you'll see that each one of the numbers, there's a few letters that are associated with the numbers, and so you can actually spell words. I know some of you may not have seen old rotary phones or the phones that are tied to that, but just so you know, it's easy to remember. 1-800-4PD-INFO will answer your questions. This group is just awesome. I meet with them once a month, and they are just really awesome at finding the answers for you and helping to walk you through any situation or any question that you have about your Parkinson. And so we're going to go ahead and open the lines up here. And so we're going to take your questions here live. And remember, this will be archived, so you don't have to take any notes or anything like that. It'll be there. But if you tell us a little bit when you ask your question about where you're from around the world, we always love that. We love to see those questions coming in from Europe and from Asia. We haven't seen a question from Antarctica. That's the only continent we haven't gotten one live from yet. So if you're in Antarctica, please reach out to us. We're happy to help you as well. And, just let us know what's on your mind. No question is too small. And I wanted to start out today by telling you a little story here to get things going. And this story actually happened in 1961. And this comes from an article that we published with a couple of students back here about 7 years ago, Danny Estupinian and Sunina Nanthu, who are here at the University of Florida. Danny now is a full-fledged neurologist. And this story was actually during the flu epidemic, okay? And then subsequently after that flu epidemic, you remember in 1917, 1918, you remember after that, there were things that people had. And there was this question whether or not Parkinson disease would be caused by the flu, and that as the folks that were in that flu epidemic, as they began to die off, that all of Parkinson disease would go away. And so in the 86th annual American Neurological Association meeting in Atlantic City, New Jersey, there were two famous neurologists, Pascanzar and Schwab, who did present this study called the Epidemiology of Parkinson disease. It received a lot of attention, and this should sound familiar to you because, as you know, our disease now, COVID-19, is receiving a lot of attention. And so there was actually a New York Times article called Palsy to Virus, and these researchers, Schwab and Pascanzar, who were very famous and at Harvard, they predicted that the Parkinson disease would die out in 20 to 40 years. It would completely die out. And what was really interesting is that in 1974, in Time magazine, they offered a bottle of scotch to any doctor in the U.S. who could send them a report of clearly diagnosed Parkinsonism in a patient born since 1931. They had paid off 14 bottles of scotch, we said in this article, and then they gave up on this hypothesis. But, there was this notion that there would be issues with the virus long term, but we now know that not all Parkinson came from the flu. But just sort of an interesting aside, this bet about bottles of scotch and this idea that when you get infected with viruses, we don't know how it's going to affect folks long term. So all the more reason for us to turn our attention to the vaccine today and to try to answer your questions. And so I see we've got some folks starting to log on here. The closed caption question, and do we have closed caption? And the answer is actually we do. When we upload this to YouTube, it will have closed caption, for it, so you'll be able to see the words as well if that's an issue. Welcome to Anna Hopper from Carlinville, Illinois. Welcome to Tiago Machado for coming in. I'm not sure where Tiago is from. I saw early on that we've got Bay Village, Ohio. We've got a question here coming in from Egypt. And so welcome. I see Nikita Krilart from the Netherlands and representing our young onset Parkinson disease community. And so let's start off here with the first question, which is, what should I be doing about COVID-19? If I got a vaccine, does that mean that I still need to wear a mask and to cover my face? And the answer to that question is categorically yes. It turns out that you do still need to mask and you still need to distance if you have the vaccine. And here's the reason why. Here's the reasoning. When the vaccine goes in, it helps your immune system. It tells your immune system, make antibodies so you can fight it off if you get it, okay? And this is very important. So I want you to listen to this. This is super important. This vaccine doesn't prevent COVID-19, okay? What the vaccine does is it gives your immune system the antibodies to say, there's COVID in my body, and you can automatically attack it, okay? Because you've already made the antibodies for it. So it actually doesn't stop you from getting COVID, okay? And so that means that if you have the vaccine, you can actually get COVID, you can actually carry COVID, you can actually spread COVID, okay? You may be less symptomatic, you may be even asymptomatic, have no symptoms, or less symptomatic because you've had the vaccine. So it can be tricky and you can still be spreading it around. So you can feel a little better when you're around family members, and if you want to see, and we have another question in here, I want to see my grandkids. So if I get this vaccine, can I see my grandkids? Answer to that question is maybe. And the answer really depends on how good you are about making sure that you're masking and distancing as well, and seeing if people all live within your same house, okay, then that's safe and you can't carry it and pass it to each other. That's the safest group of folks. But when people, even from your own families, are coming in and you don't know where they've been and who they've contacted, that's where we're seeing a lot of spread. I'm also going to remind you from some of our previous discussions on the coronavirus is that there are 3 C's that you need to remember even after the vaccine, okay? The C's are cover, control, and contain. Cover, control, contain. Cover your face, okay? And if you're using a cloth mask, a double layer is better than a single layer, okay? And an N95 mask, these are the ones that's hard to breathe out of. Those are even the best, okay? But covering your face is super important. The second C is control. Control your environment. Make sure you're staying outside, okay? and outside is better than inside. And one of the things that's driving up the numbers that we're seeing are the people coming inside, particularly during the winter months. Okay, it's people during the winter months. Okay, and then contain. The third C is contain. You want to be in small groups. We used to say 10 people or less, maybe even less than that now. Get people separated by 6 feet. Eat isolated, even rotate when you're eating so everybody has their mask on. And we try to tell people isolate. If you can go eat somewhere else and then visit separately at 6 feet away, that's even better. When those masks come down, when you want to drink coffee, when you want to eat, that's when people are getting into trouble. So cover, control, contain. Can you see your grandkids? Maybe, but you should still mask and still distance. The safest is when everybody is living within the same house. There are some strategies now that testing is more available where you can do some isolation before you get together for 4 or 5 days before you get together and everybody gets tested. That can also help to bring families back together, and something that you should talk to your medical team about. So thank you. That was an awesome question and a great way for us to start out here. I see we've got Tampa coming in, we've got Arizona coming in, we've got Europe coming in, and so welcome everyone. I want to just draw your attention that we're open for questions, and so please, you're at Ashtabula, Ohio. Jamie Lou, welcome on to the program today, and go ahead and feel free to type in your questions. So the next question that came in is about how many people, and this is from Vicky in Reno, Nevada. So thank you, Vicky. How many people have Parkinson's disease and have got COVID? Okay, is it common to get Parkinson and COVID? The answer to that question is a little bit tricky, Vicky. And the reason that it's tricky is that the data that we get this from, this is like data that comes from lots of medical records that have been packaged together. And we can use this data to find out if certain exposures or risks or procedures are associated with certain adverse events. And so we put all these people that are seen in the hospitals and the clinics together in these large databases. And some countries like Taiwan and other areas in Singapore and in Europe have better databases than other countries. But we did get the mandate from the Obama administration, I believe back in 2011, 2012, that we were going to have to all switch over to online medical records. So we have a lot of this information, who has Parkinson and who's getting COVID. Now, there was a great study that came out. This study came out from the Carver School, and the Carver School is actually located in Iowa. And at the University of Iowa, where we have a Parkinson Disease Center of Excellence, the researchers there actually were able to look, Vicky, into the records, and they realized that if you had Parkinson's disease and got the COVID-19 vaccine, your risk for mortality, for death, was increased by 30%. Wow, 30% increase. And so, although we don't have all the numbers in about how common it is to get COVID with Parkinson, and so right now we're not listing the idea of having Parkinson as being a risk factor to come down with COVID, okay? We are now beginning to see that increase in mortality rate. We're seeing it here at the University of Florida at the Center of Excellence. Certainly they're seeing it at Iowa, but at Iowa, this wasn't just a study about the Iowans that come in and are seen there. They actually were looking at one of these large databases. And so in summary, Vicky, it is not that we know right now that the fact alone that you have Parkinson doesn't put you at risk, we think, for getting the COVID infection. But if you get the COVID infection, your risk for mortality and for side effects and for issues that come out from that, those really go up. And so we are totally interested in making sure that we are creating good strategies for you to stay safe. So hopefully that helps you. As the data comes in, we may, after this is over, and this is the frustrating part, Vicky, after this is over, we may tell you, yes, indeed, Parkinson puts you at risk for having more COVID-19 infection. So far, we haven't seen compelling data to show us that. But once we have enough data, we may actually change our mind on that one. And so I want you to sort of stay with us on that. So we have another question here, a follow-up that I think is super important. And the question is what are the most common symptoms that you're seeing with COVID-19 in Parkinson disease subjects? And I will tell you, because I'm an associate editor for JAMA Neurology, for the JAMA series, that we're seeing hundreds of papers on COVID-19 and corona submitted for publication every week within the JAMA network. This is not just within the Journal of the American Medical Association. This is across all journals. So we're seeing an explosion of information, which is great. So people are writing about these things. Sometimes we're actually talking about the same patients over and over again. That's not so good. But we're starting to get information, and so it's trickling in. So can I give you a specific answer on the symptoms? No. But what I can tell you, by looking through a series of these, and I began to examine these a couple of months ago and have been trying to watch the literature all the way up until last night, I can tell you that a number of groups have looked at this, and there's a group from Milan led by Roberto Cilia, who's a great researcher there, and they did a study where they actually looked at the symptoms, and I believe that their information is consistent with the other reports. And again, we don't have a lot of information, but we do know that both the motor and the non-motor symptoms, so tremor, stiffness, slowness, and non-motor symptoms, anxiety, depression, and other things that are on that spectrum do seem to worsen, okay, with when you have corona and you also have Parkinson disease. Medication adjustments and the need for medication adjustments happen in about 1/3 of the patients are going to need to have their medicines adjusted, so keep that in mind if you get an infection. And they believe that it's both the infection and how the medications are in your system and how those things can be affected that sort of create this perfect storm of badness, of worsening. And the most common symptoms they saw in their study were urinary issues, so getting up a lot at night, having problems with urination, fatigue, worsening cognitive symptoms, meaning thinking, things like thinking, and confusion. So urinary symptoms, fatigue, cognitive function, and confusion. And so that's a paper by Roberto Cilia. We have another center of excellence at King's College in England, in London, and Ray Chowdhury leads that effort, and he has some papers that are out here recently on COVID and symptoms very similar to what I've described. And so we are seeing worsening. We are seeing needs to come back in. I spoke to our group here just before I got on. A few of the docs told me that they are having to adjust medications as people are coming down with COVID, and we're seeing more and more people coming down with the COVID virus. And so super important for us to keep our eyes on these things and on these issues. And so that's a really great question. So I want to turn to the vaccine a bit, because we have a lot of questions on the vaccine. And I want to start by a common question that has come in from multiple people, but I'm going to pick on Cindy from Marshville, North Carolina. Thanks, Cindy, for sending this in. Cindy has a reaction. She says she's allergic to the tetanus shot and been told by physicians to not take vaccines, watch out for egg-based vaccines, and should I or should I not get the COVID-19 vaccination? So, Cindy, awesome question, really important. So let's pay attention here to the answer. It turns out that the COVID-19 vaccine, okay, that we have, at least the ones that are what are called the mRNA vaccine, the messenger RNA vaccines, are among the safest vaccines that we have ever seen. This is the Pfizer vaccine, and this is the Moderna vaccine. They work on mRNA, okay? Those two are the two that are available in the United States, and I'll come to the others as well as we get through our discussion here today. Now, if we're talking about Cindy, who's from Marshville, North Carolina, we're talking about those two vaccines. And it turns out that even people who have had reactions to vaccines before and getting these mRNA vaccines, in general, most of those people can get this vaccine. So it's important to talk to your healthcare team, talk to your nurses, talk to your doctors, and make sure that you're not being overly careful, because some of what was in the actual fluid that surrounds the vaccine and the old polio vaccines and in some of the flu vaccines and things, they can also cause side effects. So some people have had side effects with vaccines before. They may not see as much with this one. But this is the one situation, Cindy, and those of you that have ever gotten an injection of vaccine and had an allergic reaction, hives, trouble breathing, some sort of issue after getting another vaccine, that's the one area, the severe allergic reactions and what we call moderate allergic reactions, when the vaccine is administered and immediately after getting a type of vaccine, that you need to clear it with your doc. Now, what you might find out, in that conversation is that they still may be able to give you this vaccine because it's a newer vaccine, okay, and that it's having much less side effects that are associated with it. And so it's super important. If you've had an allergic reaction to a vaccine before, this is the one time that we want to talk with the doc. Now, what I don't want you to do is say, I had an allergic reaction and I'm not getting the vaccine. I want you to actually speak to your docs and have a really, a back and forth conversation for several minutes, because what you consider an allergic reaction, they may not consider an allergic reaction, and it may not be pertinent to this situation. So we've had several folks that thought they couldn't get it, who now are getting it, who have had some reactions, but they've been judged to be safe enough to get it. And that has to be a discussion between you and your doc. I just don't want you to make that assumption, to go all the way with that. And adding to that, we have a question from Nikki from Myrtle Beach, South Carolina. So Nikki, thank you. You're asking about Guillain-Barré as a child, and can't get the flu vaccine because of having had a history of Guillain-Barré. What about the COVID-19 vaccine? Okay, pay attention, everyone. Okay, pay attention here. It turns out that in some of the older vaccines, especially that viscous, thick fluid that's around the vaccine, could cause side effects, okay? And one of the side effects was this neurologic syndrome called Guillain-Barré, where people can get weakness and numbness in their legs, and it can kind of come up and involve their arms and even their breathing. So a very serious effect. What is very interesting, again, because of the way that the COVID-19 vaccine has been manufactured and because of the nature of that vaccine, we are not seeing those effects in the COVID-19 vaccine. And remember, 40,000 people got it in the two big studies. So we had thousands of people are getting this vaccine. And then there was a wonderful paper that just came out in the journal Brain, which is one of the top highest impact journals in neurology. And they looked across people because, there can be associations that may not turn out to be true associations. And they looked across the people with COVID-19 and they looked at this idea of Guillain-Barré, and it turns out that a history of Guillain-Barré syndrome does not stop you from getting the COVID-19 vaccine. And in fact, we believe it's safe and we believe it doesn't cause Guillain-Barré syndrome. And so again, it's worth a discussion with your docs and your medical team, but don't just assume. Don't assume because you've had a history of this either as a child or as an adult that you can't get it. Now, if you've just had Guillain-Barré, most people are recommending you wait a few weeks after Guillain-Barré. And in fact, that was another question that came in, and that was, I've just had a Zoster, vaccine, or I've just had a vaccine for Pneumovax for flu, or I've had a vaccine for another purpose, like for herpes zoster or for tetanus. Can I get the COVID-19 vaccine? And so thank you for that question. The answer is yes, but we tend to like to wait 2 to 4 weeks after the vaccine. And that depends between different docs and different providers to make sure that the immune system that's been sort of, brought up and on board when you take a vaccine sort of calms its way back down, and then you can restart. Same after Guillain-Barré, your immune system is up after you have that syndrome. So we usually wait a few weeks after you've recovered. But if you've had it as a child or something else, then that is generally okay. Now, the Center for Disease Control, the CDC, the CDC has a website. So if you go to Google or to any search engine that you use to be able to find things on the internet. If you type into that search engine CDC or Centers for Disease Control and COVID-19 guidelines, you'll see they have all sorts of guidelines, and these can change by the day and by the week. But if you look, what is very surprising about this vaccine is that most people who are immunosuppressed with different things like arthritis or histories of cancer or other things do in general still qualify to have the vaccination. And so it's super important that you go over that with your doc, that you look on the CDC and you don't assume, don't assume that you can't get the vaccination, okay? So that's very important. So thank you for that question. And we have another question from Carol, and Carol wants to know about her dad, who lives in a skilled facility, who's had Parkinson for 15 years. He's recovering from COVID now. Does he still get vaccinated? And here's another one that may surprise you. So we're full of surprises this morning. It turns out that if you've had COVID, you can still get vaccinated, and we still recommend that you get vaccinated even if you've had COVID. We like to see by the CDC guidelines that the COVID has gone away. So usually people are going to wait several weeks until you're asymptomatic before initiating that vaccine. Now, the Centers for Disease Control don't necessarily recommend that you get a vaccine right after you're exposed. People call that like prophylaxis. Sometimes you can take a medicine right after you're exposed and try to knock it out. So if you've just come down with COVID, taking a vaccine is not recommended right as you come down with it. But once you've recovered, once you've recovered from COVID, a few weeks down the road, we are vaccinating people. And I can tell you, because here at the University of Florida, we have a number of healthcare professionals and people that I've worked with who have gotten COVID-19 and then have subsequently been vaccinated. And people say, they assume, well, I've had COVID-19, I don't need the vaccine because I've already made some antibodies. The answer to that is we actually don't know. We don't have enough information to know. And the mortality, the death rate, and the morbidity, the side effects from this are so high from this virus, and the risk is so high that we still recommend that you get vaccinated and stay protected for as long as you can. And so if you've had COVID, you recover, and we still recommend being vaccinated. And in fact, one of the most common questions that's been coming in here for us is about, whether or not do we recommend, if you have Parkinson disease, that you get COVID-19 vaccination, okay? Do we recommend that you get the COVID-19 vaccination if you have Parkinson disease? And the answer to that is categorically yes. Yes, we do. Not just at the Parkinson Foundation, but our recommendation has been followed and concurrently been made by all the other major foundations for Parkinson disease all over the globe, by the Movement Disorders Society, and by many others. The risk-benefit ratio is far in your favor. This is the safest vaccine that I have ever seen in my career. So any of you that have had polio or other vaccines, the safety profile is just tremendous for this vaccine. It's really, really good. And so in medicine, when we make decisions, we talk about risks and benefits. And so, the benefit is just so high for doing this. And I just want to say, I've lost patients with COVID-19 and Parkinson disease, and that's not scientific, okay? And we're going to get the data as data is coming out, but, folks that we're losing in our practice, we believe these, are potentially preventable deaths by doing the 3 C's: cover, control, contain, and get vaccinated. It breaks my heart. And so, the risk benefit is really in your favor, to be vaccinated. And so we definitely want you to pursue this, and it's really important. And one of the things I'll also share with you is that I've had a lot of discussions with a lot of people from all over the world about the vaccine, and some people that don't want to get the vaccine, that they're scared of the vaccine. And you know what? I totally get it, and I think it's really important to have that discussion. And one of the things that I think has been really eye-opening for me is when I just have the discussion and just, try to understand why people don't want to get the vaccine, whether they are worried about the safety or they want to wait a little bit or they don't believe in vaccines or they've seen side effects or if they've seen other people in their family that has side effects, they don't trust the medical system. I think all of these things are totally reasonable, and I think it's important to have that discussion and sort of back and forth. People want to know from me, one, would you get the vaccine? And my answer is yes, and I have had the vaccine. And so after our first level providers here at the University of Florida got it, these are people that are putting in breathing tubes and dealing with aerosols, and our nurses and responders. After they got it, then the next group of nurses and allied health professionals and some of the doctors have gotten it. And so on this last round, I did get the COVID-19 vaccine. So I do believe, in it myself. So that's the first question that people ask. Would you get it yourself? Would I recommend it to any of my relatives? I've recommended it to all of my relatives. People often will ask me that. Categorically get it, whether you've had Guillain-Barré syndrome or not. And if you've had a reaction to a vaccine before, having that discussion with the doc, because sometimes it still is safe to get it. So I think that that's important. And then the safety profile. And one of the things that I think is lost a bit on this is that the number of people, the number of folks who have actually been tested, okay, the number of people that have been tested, okay, with this vaccine. So they got it during the clinical trial and they were followed out and they looked at their antibodies and they looked at their side effects. The people who passed away, who died, who had mortality, were in those groups that did not get the vaccine. They got the placebo version, okay? Not the people that got it. So I think a lot of people are not aware of that. I think I would want to know, like, the people that actually got it lived. So that's a good thing and did better. And so it increases your chance of surviving, okay? And it decreases your risk of going to the hospital and having severe side effects. And with your Parkinson, it's harder to recover from it. And that's what we're finding categorically. I've lost a few patients here recently. It absolutely breaks my heart because I've followed these folks here for many, many years and were otherwise doing well. And COVID was what took them out. They were having good lives otherwise. And so the safety profile is really, quite excellent with this. And the side effects, okay? The side effects are mostly local. And so when you get vaccinated, what happens is your immune system really revs up. And as your immune system revs up, you will get some local reactions. And so it usually goes in the muscle, and usually the muscle here up in your shoulder. And I always recommend to people be vaccinated in the arm you don't use as much. So I'm right-handed. My wife's left-handed, right? So I'm right-handed. I want to go into my left arm. My wife is left-handed. She wants to go into her right arm because the most common effect is soreness. You'll get this sore, sort of almost dead, but sore arm. You can still use it, most of the time. And, when Sanjay Gupta got the virus, he talked about how you could still throw a ball with it. It's still usable, but it can become sore. And we tell folks, to pre-medicate with a little bit of Tylenol. That might help with the soreness. And then after you're injected, you can use things like non-steroidals as long as they're safe and as long as your general doctor says they're okay with your GI system, your gut, and your kidneys. You can use things like ibuprofen, Advil, Aleve, naproxen sodium, and you may have to use those for a few days. Now, about half of the people that get the vaccine, okay, particularly after the second shot, and remember you wait a few weeks and then you get the second shot, will get a very mild flu-like syndrome, okay? And some people will get a little more severe flu-like syndrome. So they may actually get some fevers, okay? And their temperature may go up, they may get some chills, they may feel bad for a day or two. And that's why we tell people when you get your second dose, be careful if you have to go to work the next day. You might want to have a day off or plan to do it on a day where you're not having to work or having to do something important. It's usually a sign that the vaccine's doing something. It's really revved your immune system up. It's not a sign that you come down with COVID. COVID often has a lot of upper respiratory tract symptoms, cough, other things. But if you see a flu-like syndrome, particularly after the second shot, that is really, really common with this, and so it's important to keep that in mind, and especially for scheduling. But when you see that, that's not actually a bad thing. It's a good thing because you want your immune system to be livened up, to be woken up, and and this vaccine is definitely waking up the immune system, and so I think that that it is super super important, and so I think the whole group of people asked that question from multiple areas all over the world about what are the side effects, mostly local, with redness, with deadening of the arm. Some people will feel a little numb on that arm. And then sometimes there's these more we call systemic, like little mini flu. If the mini flu lasts more than a day or two, you need to check in with your doc or your allied health professional team. So again, fantastic questions keep coming in, and so thank you so much for these. I want to remind you here. I see Beth Trier is on, Jamie Lou's on from Ohio. You can type your questions in here into our little search engine here under the Tips for Parkinson Disease, our webcast here with the Parkinson's Foundation. We also have the best helpline, 1-800, the numbers 4PD-INFO is what it spells on your phone, and they'll answer your questions as well. And so really, really great questions. And so let me pivot here. I've got a question from Cooper City, Florida, from Tatiana, who wants to know, with her husband scheduled to be vaccinated and has Parkinson for 7 years, what do I need to take? Do I need any documents or anything on my way to get the vaccine? Well, some local health departments are actually doing pre-screening on the computer, where you fill out some of those pre-screening questionnaires so they can make sure you're safe to get the vaccine. It's always good to bring a list of your medications in case they ask you for them. They are going to ask you to stick around for 20 minutes to make sure you don't faint or pass out or have, a little bit of a fear, reaction that can happen right after giving any type of vaccine, or sometimes when you give blood, and so it's important. Some people will bring a little bit of a snack, just in case their blood sugar gets a little bit low. And then again, using some Tylenol an hour before helps with some folks, particularly for the local stuff. And then some of these non-steroidal things like naproxen sodium, ibuprofen, if it's safe with your other medical conditions after you come along. But I think just bringing along your information about your medications and your diagnosis on a piece of paper is useful for the folks that are doing this. It's a kind of a high throughput. We're trying to do a lot of people all at once, but it is useful, particularly if you run into any trouble or you have any questions and you want to sort that out, with the folks that are there on site. And they will, again, have you stay there usually for 20 or 30 minutes after the vaccination to make sure that you don't faint and that you're safe, particularly if you're driving yourself. And always good to have somebody else drive you when you're getting a vaccine, but just make sure that you're safe when you head out. Now, we have another question from Oxon Hill, Maryland, and this question's from Will, and Will wants to know about blood pressure. He's had severe blood pressure issues. Is blood pressure one of those things that we worry about with the coronavirus vaccine? The answer is no, although it's nice to be sitting when you get the vaccine, Will, because you can get an acute blood pressure change, from getting a vaccine, and you can pass out. And so that's one of the things that we worry a lot about. Now, in general, as you point out here, and thank you for writing about your particular situation, when you have low blood pressure already with Parkinson, you're already at risk to pass out a little bit more. So staying super hydrated, Will. And I always say when you take your Parkinson medication, I have the water bottle rule. Make sure that you take a bottle of water with your Parkinson disease medications, and make sure that you are staying super hydrated, because that is one of the most important things that you can do. And so coming into the vaccination super hydrated, having drank a lot of water is really, really important. So thank you for that question. We got a question in from the helpline about the advantages, disadvantages, differences between the different vaccinations and around the world. And so let me review that for you all a little bit. And I know, first of all, let me just point out, I know that not all of you are from the United States. I do live in Florida, and I'm at the University of Florida in the United States. And so because of that, not because of any other bias, I'll start with what's available in the United States, but I'll work my way around the world a little bit for you. Now, there is a vaccine that has been made by a company called Moderna and another vaccine by a company called Pfizer. Those are the two that are available in the United States. The way that these vaccines work is they send a message into your cells with something called messenger RNA. Messenger RNA is something that's in your cells anyway, and it tells you how to make proteins, and these are kind of the building blocks of what you need in your life and to make important things. And so it kind of sends the instructions in. It's super, super clever, guys. Super clever. You send the instructions in using this messenger RNA with Moderna and by Pfizer, or Pfizer BioNTech is the partnership. You send the message in, and it tells your cells, make the protein that's on the outside of the coronavirus, which is kind of like a baseball. You know, if you think of a baseball, and then if there were little spikes sticking off of that baseball, the little spikes are what you can actually use to create antibodies. And so if you tell your body, if you send a message into your body and you say, this is the spikes, and make some of those spikes, okay, which are not harmful at all, then your body can make the antibodies to the spikes. And the spike proteins, the spikes that come off that baseball, is how coronavirus gets into your cells. It's very clever, very safe. It's never really worked in a vaccine before. We've been very interested in it. We started to experiment, and it's never worked in large scale, but we started to experiment in SARS-CoV-1 and in other disorders in many labs around the world with Ebola. And so we're learning a whole bunch about how to use the technology, but boy, did it come through. This is unbelievably fast, and these went through clinical trials. So it sends a message in. You actually make the little spike proteins that helps corona get into the cells. Those won't hurt you, but your immune system sees it. It makes antibody, and so what happens is that you now have the antibodies. So if you get infected with the coronavirus, you're already going to have the antibodies to respond to it. Which, by the way, just to reinforce to you, because you've had the vaccine doesn't mean you cannot get infected. You can sure get infected, but you'll have antibodies, so that will hopefully either make the infection asymptomatic or less severe, but no guarantees. So you still want a mask, and you still want to socially isolate, because you don't want to spread it and give it to other people, particularly those who haven't been vaccinated. And so until we get 70-80% of the population vaccinated, we still need everybody to be masking and socially distancing. So the two from the United States are the Moderna and the Pfizer BioNTech. These are mRNA viruses. The Moderna, you have to get your second dose at 28 days after. The Pfizer, you get it at 21 days after. And the efficacy, how well was this? How well did it perform in preventing coronavirus infection? Okay, and or actually, it doesn't prevent it, so the virus doesn't prevent it. But how efficacious was it against the coronavirus infection? And the Moderna vaccine was about 94%, and the Pfizer vaccine was about 95%. This is unbelievable. I mean, these numbers for how effective these vaccines were are really out of this world, way better than any of us thought. I mean, I don't think Dr. Fauci, anybody ever dreamed to see those numbers were going to be so high. Difference is that the Pfizer BioNTech vaccine, because it has this mRNA in it, has to be stored at negative 70 degrees Celsius. That is really cold, and it needs specific, types of refrigeration. So that makes it a little bit harder to deal with that. Whereas the Moderna is only at negative 20 Celsius, so it doesn't need quite that same level of refrigeration. And so we've had to learn with shipping how to do this. And the cost per vaccine, just a guesstimate has been about $30 plus on the Moderna, $20 plus on the Pfizer. That would be about 25 pounds and 15 pounds if you're British. And you can do the math across the other countries. So that's the Moderna and the BioNTech Pfizer vaccine. These are mRNA vaccines. There is no difference in the primary outcome variable of those two. Once we get the data and we can dig into the data a little bit, there might be subgroups that are slightly different. For example, some people think that maybe the Pfizer is slightly better, in the super old people, however you define super old. And as I'm getting old, I don't like that term, but those types of things we don't really know enough about. Now, the other virus or the other vaccine that we're interested in is the Oxford Astrozeneca. So the University of Oxford in England and AstraZeneca partnered up. This is a DNA-based virus, not an RNA, so it's more stable, okay? Because RNA is a single strand. DNA is what kind of makes life, has a genetic code. So it's got 2 strands on it, and they use what's called an adenovirus. It's a virus that causes cold in chimpanzees. And they use that virus as a delivery, as a vector. So they say to the virus, it's an inactivated virus. They're going to send in this information, this DNA base, to say this is the instructions on how to make, that protein, that causes the infectivity, and teach your immune system how to respond to it. So it's a slightly different strategy. Now, you have to get, again, 2 dosages, and there's been some controversy about this in the news press. You may have seen this, because the second dose and the availability and the cost of that dose, there has been a question whether it can be delayed for a while so more people can get that first dose. The World Health Organization and others have weighed in and said that's probably not a good idea. So it's about 3 to 4 weeks between those shots. And I was talking to Johnny Atchison, who is a Parkinson patient, runs a great blog, and is a great artist, and he draws for our ParkinsonSecrets.com blog. We have a nice blog for Parkinson disease, and Johnny is works as a healthcare provider there in the UK, and he tells me 3 to 4 weeks after you'll get the second dose. Now, when you had the dosages, and what was very interesting about this study, and we still don't completely understand this, but we're getting there with our understanding, is that if you get the 2 doses, overall the effectiveness is 70%, which is excellent. I mean, outstanding, okay? But if you got a lower dose of the first dose, and then followed it with a higher dose, so you prime the immune system with a lower dose, you didn't overwhelm it, and then you give a higher dose for the second injection, you get up to that 90%, which is closer to where Moderna and BioNTech is. And there's a lot of speculation as to why that is. We don't know completely, but we have some ideas, and it's quite intriguing. One of the cool things about the Oxford Astrozeneca vaccine is that it can be stored in a regular refrigerator temperature, and they're keeping the cost down to about $4 or £3 or so. And so this is the one that, like people are looking at and saying we could get this to more countries, more people, and more of the developed world. And so it's really interesting, and so that's why you see that average between 62 and 90%. Depends on if you got a lower, it's counterintuitive if you got a lower first dose of that vaccine. So again, it's the chimpanzee virus. The virus is inactivated, totally safe, sends that message in. Because it's a DNA message, which is a little more stable than the RNA, you can store it at regular refrigerator temperature. We can get it to more people, okay? Then we have several other vaccines, and there's several in development, and there's a whole bunch of ideas that are in labs. And what's really cool about the whole vaccine discussion is that how these have really worked and worked quickly. And it usually takes years and years and years. And the reason it didn't take years and years and years this time around is because the regulatory agencies like the Food and Drug Administration in the U.S. and the equivalent agencies, they were getting data in real time. Instead of waiting for the studies to be done and waiting to see what this study would show to go to the next study, the companies and universities were giving them data in real time, and it really sped the process up. So there weren't steps that were skipped, but they really, stepped on the gas and catalyzed. Now, we saw the Sputnik 5, the Gamaleya vaccine out of Russia. We don't have as much data on this. We believe that it's a little similar to the Oxford vaccine in that they're using an attenuated virus to deliver this. I think it's an adenovirus. Again, I haven't seen the published findings, the full published findings. There have been some exports of this to other countries around the world. At least the listing and the small amount of data I was able to find is people are getting that 21 days, the second shot at 21 days. The effectiveness was reported at 91 to 92%, but again, there was only a few hundred people at most that we've seen, and so we need to see the full data. But again, it's regular regular refrigeration, regular temperature, so the cost per vaccine is lower. So if it's safe, this could be great. And the Sputnik 5, the Oxford vaccines, these are more like what we use with our flu vaccines. So a flu vaccine is an attenuated virus, so don't get scared. These are fine. If you can get this is fine. These are safe. These are effective strategies. We can't comment on the Sputnik 5 in terms of its safety and efficacy and effectiveness, and particularly its safety, until we see more data. Okay, so if you live in one of the regions where this has been shipped to from Russia or in Russia, we'd like to see a little more safety data, so we can't comment, but that's as much as we know. And then in China, there's a couple of vaccines that have come around. A Sinovac vaccine and a Sinopharm vaccine. We've seen a couple of different reports with a couple of different effectiveness percentages. We've seen 70%, 79%, 80%. We haven't seen all the data, so again, we're not sure. We've seen in the early studies that second dose between 14 days and 28 days. So, somewhere in that 2 to 3 week to 4 week period, probably going to be closer to 3 to 4 weeks if we compare it to the other vaccines. But again, a 2-dose vaccine. We believe that these are also adenoviruses. So just like this chimpanzee virus, very similar to what's in the Oxford vaccine. And we believe it's a sort of an attenuated virus that doesn't cause infection and carries information in. And so we're waiting for more information, but it is really, really great news that we're seeing vaccines, sort of across the board, across different countries. And we're also seeing that the strategies are working. So again, if we can get rid of the refrigeration of the vaccine or go down to room temperature or a regular refrigerator, we can get it to more people. Some of the old-fashioned vaccines with the attenuated viruses, we can make those cheaper. So, this idea that AstraZeneca may be able to get out to the developed world could be a game changer for a lot of people around the world. So that's a little bit of a review on what's going on with the different vaccines. We definitely are recommending, just to be a little bit repetitive, that all folks with Parkinson's disease do get vaccinated, or at least have the discussion with their healthcare team. And some of the people, after they have the discussion, they realize how effective they are, how safe they are. These seem to even be safer than other things that we're seeing, like flu vaccines. That they might change their mind. And also knowing that mortality data, knowing that the people died that didn't get the vaccine, the people lived that got the vaccine. Some of these points have been really, really, important for folks to make their decision. And certainly we don't want to force anybody to get the vaccine, but certainly if you don't get it, definitely mask, distance, do everything that you can, lay low, until the numbers go down. And once we get the population vaccinated up to 70, 80%, this is going to be a game changer for us taking the next step to getting out of the pandemic. Now, I want to mention that some of you may have seen in the Washington Post, this was brought to my attention by Leilani Pearl at the Parkinson Foundation, that the Alzheimer's Association is looking into and studying COVID as a cause of future dementia. And, this is super, super interesting and super scary all at the same time. And actually, there are other studies of this, various other studies that are going on across not only the United States, but across the world, looking at the long-term effects of the virus. And remember, I started out talking about flu, and people realized that flu could cause some Parkinson's symptoms. And we're seeing actually a few cases now. There's just not enough data yet to make that determination. But we are seeing neurological effects, long-term neurological effects from having COVID-19 infection. And we are worried about COVID-19 potentially attacking and causing neurodegeneration. And the editor of the Movement Disorders Journal, which is one of the top journals in the Parkinson field, is John Stossel. And John's from British Columbia, and he and his group had a nice letter in the Lancet here recently, looking and just talking about this issue about precipitating neurodegeneration. and looking at how the COVID-19 and other similar viruses use something called an ACE, an ACA2 receptor to get into the nervous system and the brain. They get access. How it affects, in one of the very interesting things neurologically is the effect on smell. We call it olfaction, and people are losing their smell. We've not seen anything like this. And then when they get better, they're regaining their smell. And John and his group were talking about maybe there are certain cells within the nervous system that are selectively vulnerable. Maybe there are people who have selective genotypes, certain genetics that it just is. You're just more vulnerable to this. And we've seen other viruses like the West Nile virus that could be actually protective against some of the depositions like synuclein and in other viruses that might be causing these Lewy bodies or synuclein depositions in the brain. And so thinking through this and thinking about the inflammation and speaking with Malu Tanzi, who's at UF, who's one of the great neuroimmunology researchers in the field, and this inflammation aspect of COVID-19, particularly in the long haulers, is something we're really worried about. So another compelling reason to think about the vaccine is we are seeing people with long-term effects, and we don't know what's going to happen long-term. So I know, I started here today talking to you about that story about flu and the Harvard neurologists and Pascanzar and standing up in front of a group in Atlantic City, New Jersey, and betting everybody and putting it in Time magazine in 1974 that all Parkinson is due to the flu and it's going to disappear, and it made the New York Times. And so we're seeing tons of reports. And so seeing something in the Washington Post about long-term effects, I think, is important, but I don't want people to get too excited or too worried about it causing dementia. We don't know that, but we won't find the answer out, for many years. And because we won't have those answers for many years, this is all the more reason for us to do the 3 C's, to cover, to control, to contain, okay? Cover your face, control your environment, stay outside if you can, contain, stay in small groups. If you're eating, try not to eat in front of other people. Try to separate out when you're eating. Keep your mask on. Even if you get the COVID-19 vaccine, it doesn't prevent infection, and you could still be a vector, meaning you could still spread it to other people. So these things are going to be really important for us to get out of this. And some of these questions, like, were Parkinson folks more apt? Were they at higher risk to come down with COVID-19? We don't think so. We won't know for several years. Like the Washington Post was talking about in their article, will this cause long-term dementia? Like we talked about the flu virus. We now know the flu virus could cause Parkinson, okay? And does it cause these long-term effects? We don't know yet. And because we won't have that data, it's all the more reason for you to stay safe. And we recommend highly that you get the Parkinson vaccination. We are going to keep as much information as we can up online for you. And so we are going to have that information at www.parkinson.org. And then if you put a backslash, if you want to search around our site, we've got a lot of stuff on Corona and COVID. But if you want to get there faster, /COVID or /coronavirus, all one word. Kathy Whitlock and her team and Leilani Pearl and the whole overall team and strategy at the Parkinson Foundation has been that we are here to help as much as we can. We want to impact your lives in positive ways. We want to prevent this. We've been just heartbroken with the number of folks who have been infected with COVID-19, and we've seen some bad outcomes from the infections with COVID-19 and Parkinson, and so we want to avoid that. If you get into trouble, please remember you can call our 1-800, the number 4, PD, the letters PD info, okay, 1-800-4PD info. Talk to our nurse and allied health professional helpline. They are awesome. They will help you, okay? If when you get infected, if you do get infected with this, whether or not you've had the vaccine and access to the vaccine, we want you to let your healthcare providers know immediately in case they can do things like giving steroids early is very important in this. Thinking about monoclonal antibodies, if you're going to do it, you need to do it right away in the first couple of days. But it's game changers to get on this earlier. And so we want to know when people are going to the hospital. We want to know earlier. And the allied health professionals at the 1-800-4PD-INFO helpline can get you access to our Aware and Care kits that have all the information you need to survive a hospitalization, particularly in places where we know that they don't know as much about the care of Parkinson's disease. Now, I want to end by just a few words on access, and we've talked about access to the COVID-19 vaccination in our most recent blog at parkinsonsecrets.com. And it is really frustrating because the vaccines coming in and being shipped into all of these states, and each state has different rules about how it's going to give out the vaccine. So, for example, in the state of Florida, at the University of Florida, the vaccine is given out first to healthcare professionals, and that's sort of been what we've been told from the national that we want to do. We want to do the frontline healthcare, workers who are at highest risk first, and then they're going to start to divide people up by age. So the older you are, the better chance you have of getting it. And if you live in a nursing home, facility or a large facility, better chance of getting it earlier. The problem is that, a lot of times we don't know when the shipments are coming in and how to get them out. The good news is that a lot of the healthcare providers are all getting vaccinated. Like at the University of Florida, we're trying to do this as quickly as we can, get as much vaccine as we can. So now, we're going to pivot here in a couple of days and start giving it to the community, so people that live within our county, okay? And so it's usually in the United States. It's different across the world, divided by counties. And so we recommend that you go in and you click on your web browser, whether it's Google or Chrome or Internet Explorer or whatever, and you type in health department and your county. So for me, that it's Health Department Gainesville, Florida, which is Alachua County, and you get on their list. Now, some of them don't have a list. You call in and the numbers and the lines are getting crazy and you can't get through when you're trying to call. Some have forms that you can fill out where you have to tell them where you live so they know which zip code you're in, because they're allocating usually based on where your primary residence is. And so we recommend people get on the list or try to call in. Now, this idea of like, here's some vaccine, it's available, let's go camp out at night and all be on top of each other and go crazy to get the vaccine, we're recommending against that. Okay, what we don't want to do is for our Parkinson folks to go out there to fall, to put themselves in harm's way, to actually pick up the vaccine by not distancing, by sleeping there overnight. We would rather you get on the lists, get an appointment, and get access, to it. And we know that everybody's hurting and everybody wants to get this vaccine. And the most frustrating thing for me, I was in clinic this morning, so I'm seeing patients from Louisiana and patients from Georgia and patients from Florida, patients from overseas, and it's just different wherever you are. And so if you live in Germany or you live in Europe, I was talking to Johnny Atchison yesterday, it's different how they're allocating it. And so it's important for you to just to get with your local authorities, know where you can go, okay, where is the vaccine, and sign up with your health departments, and make sure that you're on a list if they have it. And then the other tip I'll give you is that as hospitals get it, okay, after they've vaccinated their folks, and some of the folks are not taking the vaccine, so they're waiting, they want to see a little bit how the safety data is going, and so there's some extra vaccine even from those groups. Be in touch. Figure out which hospitals are getting it locally and make sure you're in touch with them, and then if they have some extra vaccine, they can give it to you, and find out when they're going to turn to the community and how they're going to give it, and see are they going to partner, or is vaccine going to be given out by local pharmacies. It's very different in different areas, and it's making it really frustrating for us, because we've been lobbying to try to get the Parkinson folks all the way up on the 1B. No matter how old you are with Parkinson, we want you to have access to the vaccine, because we think you're at higher risk, meaning it's going to be harder for you to recover if you get corona. And so we're now worried that only some of the older age groups are getting it and not the younger age groups. We are very, very encouraged by some of the lobbying that we've done and the responses that we're getting, that it looks like as this rolls out to communities, that it will be the local providers will make those decisions as to whether or not, you're in an at-risk group and should get it. And so we have labeled at the Parkinson Foundation, everybody with Parkinson disease is in that at-risk group. But those decisions are actually made by the local folks that are there. And so you might just remind them that we believe that having Parkinson at any age puts you at higher risk, so you can try to get access to the vaccination. And of course, you can have them call our helpline too. We're getting a lot of calls there, 1-800-4PD-INFO, and we're always happy to help. But access is super important, and we're hoping that as we get through the healthcare providers here, we're going to get more vaccine out to communities. If it was up to me, I would be vaccinating everybody with Parkinson, no matter what age, and doing it tomorrow. And I just want to just say how much our hearts go out to all of you that are sitting and waiting for the vaccine, because it has been a really, really frustrating time for folks. So thanks again for hosting here and for spending the hour with us. We got lots of good questions on the vaccine. We're certainly willing to keep doing these Corona Facebook Lives. We've done a number of them. Please check us out at parkinson.org/corona or COVID for the list, and they'll have all the previous Facebook Lives that I've done. And if we need to do this again and answer some more questions live, I'm happy to get back on. And please, everybody, stay safe, and let us know if we can help. We all need to help each other, and the kindness and the compassion that I have seen from not just the Parkinson community, but from America, from everybody around the world, from international locations, about everybody helping each other through the pandemic, is probably one of the things that has really given me strength to continue, and try to help as many people as I can. And so your kindness and your compassion is fuel for all of us who are healthcare workers and frontline providers. So keep being kind, keep being compassionate, be as patient as you can with the vaccine, but be smart and try to get on those lists and contact your local hospitals and see how you can get it. And stay safe, everyone. Thank you.